Hey everybody, we've made it to Friday again, and that means the Doctors In Live with TOA is here. Thanks for being here with us. I hope you all have had a good week. It's been a challenging week, an interesting week, and I hope everybody's staying safe. Once again, Live with the Doctors In Live with TOA is an informational series. We hope that we're providing people with interesting topics and interesting discussion, but we'd love to have you participate in formulating our topic series, or series topic. So please, if you have ideas about topics you'd like to hear about, for example, last week we had a request to talk about bunions, and we're working on a foot and ankle guest to appear. And so we'll add that to the mix. Last week's topic was scoliosis, and we actually had requests to talk about that as well. So please, if you have any interest in a topic or a problem that you've had or a question, leave some comments down below and we'll look at it, add it to the list. If we can answer your question directly, we'll do it. If we can't, we'll get somebody here who can. I'm Stahlman, I'm your host. For those of you who've not been with us before, we've been trying to do these live episodes about every week. We don't always make it, but we try. We've been having some good luck with some guests recently, and we're looking forward to increasing the number of guests that we have so we can talk with a variety of people from TOA about musculoskeletal topics. So keep looking for that. Follow the Facebook page, announcements on Instagram. We do have these videos essentially in a library on our website as well as YouTube as well. As always, even though I'm an orthopedic surgeon, I'm not your orthopedic surgeon, so please don't consider this information that we talk about today medical advice. Think of it as information or education or entertainment information. If you have an orthopedic problem, a musculoskeletal problem, please go to TOA.com. I'm sorry. And we can give you information about our offices, our practice, the doctors, our services, and that type of thing. So today we don't have a guest, but we're going to talk a little bit about something that's really interesting and important to me. Basically, my entire adult life, I've been a passionate cyclist, a bicycle rider, and I've also gotten older. My body's changed, and while I was riding with a friend of mine a few weeks ago, actually, I mentioned him last time, I believe, or time before, when we talked about him talking about having a hip replacement and how to choose an orthopedic surgeon. I mentioned my friend before. While on that ride, and by the way, he's doing great. His hip's doing awesome from what I gather. I started noticing some problems in my own body when I was riding. Typically, used to be, when I was younger, I could ride without pain. Well, pain's actually a really common problem in cycling, and I wanted to talk a little bit about cycling pain problems and what we can do to try to analyze them and take care of them to make your cycling adventures much more enjoyable. The topic we're going to discuss today is really geared more toward road bike cycling rather than mountain biking. I'm not a mountain biker, so I don't really have good information specifically toward mountain biking. This should apply to recreational cyclists, to casual cyclists, as well as high performance or endurance athletes and cyclists. I hope it's some valuable information. And so we're going to talk a little bit about bike fit, and try to avoid how to avoid or minimize pain in your cycling endeavors. One thing we're not going to talk about is, forgive me, butt pain. The most common places we see pain is where your body interfaces with the bicycle, and probably the main area of of that pressure is your seat, your rear end. And there's a lot of things that deal with tail pain, rear end pain, butt pain, whatever you want to call it, and cycling that are really kind of out of the scope of this talk. I will say that many times simply using cycling shorts rather than running shorts and or cargo shorts or something like that can make a huge difference in your comfort in your rear end. So we may talk about that another time. Anyway, so we're going to talk about the skeletal stuff. And there's kind of 3 or 4 main areas where people have pain problems. Number 1 is the knee. Number 2 is the back, the lower back. We'll put the neck in there too. Number 3 is the hands. And then number 4 is kind of just the general body and the feet, okay? So knee pain is probably the most common thing we see with cycling and pain. And it kind of comes down to how, again, we interface with the bike. You'll hear me say this over and over today, but really the most important way to make your cycling most comfortable is a good fit with your bike, okay? How your body and the bike interact with one another. So we're going to talk a little bit about knee pain first, and there's kind of 4 different locations where people feel knee pain. I'm going to have Kevin help me out here. The first is what's called anterior knee pain, and anterior means front, and so the front of the knee here, your thigh bone is here called the femur. This is the kneecap or patella, and then this is the tibia bone or the shin bone down here. And the muscles in your thigh, the quadriceps muscles, attach to the kneecap or the patella, and then attach down here to allow you to straighten your leg out. So the purpose of the muscles in the front of the thigh are mainly to straighten your knee out. Anterior knee pain, pain in the front, kind of boils down to several factors of bike fit. Probably the most common reason why people have or develop anterior knee pain is their seat is too low. Another reason why is their seat is too forward, so they're too close to the handlebars. Number 3 is occasionally the cranks, the bar on the bicycle where the pedals attach can be too long, and that makes your knee go further than it should. And then lastly, and this is more relevant to the more advanced cyclist or the longer distance cyclist, is too much too soon early in the season. So our parts aren't yet ready to tolerate the stresses of cycling. So why would a seat that's too low or a seat that's too far back cause us pain? Well, what happens is if your seat's too low, your knee can't straighten out fully. And so you're kind of stuck here. And what happens is the area where the kneecap attaches to the tibia bone here can get inflamed and irritated. In addition, the kneecap can run in its groove right here off center, and that can lead to pressure on the cartilage. So it can be a tendonitis problem. It can be a cartilage rubbing problem. So raising the seat just a little bit can allow our knee to more fully extend and put less stress on those attachment points. In addition, strengthening the muscle on the inside of the thigh, which is here, called the vastus medialis, can help that kneecap to track better. The vastus medialis works on the inside part of the thigh, and it helps to raise your knee up. But cyclists typically increase the muscle mass on the outside of the thigh, and that kind of gets left behind. And so one of the simple exercises for people to strengthen the VMO or vastus medialis is a simple exercise that goes from about 30 degrees of bend to full straight. And what I tell people to do is basically step sideways on a stair, so your knees bend about 30 degrees, and just stand up, straighten your leg, stand up, let it bend, stand up. It doesn't need to be full squats, and in fact that doesn't work the vastus medialis. It doesn't need to be leg extensions. It's a very simple exercise that's only that 30 degrees to full straight. That can go a long way as well of helping to mitigate or reduce anterior knee pain. Now, when we talk about changing positions of bike components, the seat post, that kind of thing, these changes should be made in small increments. And small meaning a 1/4 inch or less at a time, because a little bit too much difference can get us into other problems. And there's a very subtle kind of change that your body can tell the difference. And so if we're changing bike position and frame component position, we need to make sure we do it in small increments. So number one, we can tell if we're helping. Number two, we don't overload something in the other direction. So another thing that oftentimes gets people into trouble, particularly in Middle Tennessee, is really when you're riding in the hills, is putting it into a higher gear or a harder gear and pushing hard. So you may be pedaling more slowly, but you're pushing a lot harder, okay? What that does is it forces the quadriceps to pull on this attachment, or the pull on the attachment here at the top of the kneecap, and strain those soft tissues. And that strain can lead to a tendonitis problem and an overuse pain problem. And so one of the things that we really think about in the hilly terrains like Middle Tennessee is using different gear ratios. So you actually want to use the gears to your advantage, which means choosing a little bit lower gear, which is either using the small chain ring on the front on a road bike or a bigger sprocket on the back cassette, in order to make the pedaling a little bit easier. You're not going to be putting as much strain through each revolution. You're not going to go quite as far per revolution, but it puts less strain on the knee and therefore can decrease the chance of developing a tendonitis. That's where using things like a compact crank in the front, which means a little bit smaller chain ring set in the front, and a larger spacing of the sprockets in the back, what's called the cog set in the back, to get a little bit bigger gear, a little bit bigger range of gear ratio. A little bit lower gear can help decrease the strain on the knee. That's also helpful in people who are recovering from this knee pain problem. The last thing is the seat, forward and backward. If you're too crowded, if the seat's too far forward toward the handlebars, again, your knee can't straighten out like it's supposed to, and it can cause you to have to overload those attachment points. So subtly, usually what I look at is seat height first, front back next, crank length. That's rarely a problem that most people fall into, because most people's crank lengths can be adjusted for with the seat height. And then the loading and the muscular strengthening. So as we have anterior knee pain, we can now also have posterior knee pain. That's pain in the back of the knee. That's where the hamstring muscles attach from your buttock area down to your shin, and then your calf muscles attach from your upper part of the shin bone down past your ankle. It's kind of the opposite of anterior knee pain. So seat too high, seat too far forward, seat too far back, cranks too long. And what that does is it essentially forces your knee to straighten out all the way or even hyperextend. And that can strain the tissues in the back. So anterior knee pain, it's seat too low, seat too far forward. I think I've misspoken. It's seat too far forward. Posterior knee pain typically is seat too high, seat too far back. And again, adjusting those things a little bit at a time to try to help balance that out can be very helpful. Another thing that's very important in endurance athletes, runners, and particularly cyclists is we tend to get really big hamstring muscles, which then also cause our hamstrings to get very tight. So in effect, they're shorter than they typically are meant to be, so it's harder to straighten the knee all the way out because you're fighting against that muscle back in the back here. And if you're trying to force the muscle out with tight hamstrings and a too high seat, that can really cause knee pain back in here. And so adjusting so that you're a little bit more flexible with the hamstrings and a little bit less tight in the height can make a huge difference for you in that regard, okay? Now, you can have pain in the side of your knee. So lateral is outside, medial is inside. Some of those can be related to internal joint problems like cartilage tears or arthritis, but sometimes it can be related to how your feet are positioned on the pedals. Most road cyclists these days use clipless pedals, which are the things that you snap into. Some people still use toe clips, which are the cages with the strap that helps to secure your foot to the pedal. If the cleat on the bottom of your toe clip, your clipless pedal, is too far to the side, it forces your foot inside and forces your knee to work to the outside. So that can increase outside or lateral knee pain. So sometimes just shifting the cleat a little bit more toward the inside, toward the big toe side, can really help with that. Another thing that the clipless pedals are guilty of is sometimes the connection between the cleat, the thing on the bottom of your shoe, and the pedal itself can be too tight. There's a term called float, and that's where the pedals are allowed to kind of waggle. If I'm looking at the bottom of your feet, they can kind of waggle like this so that differences in your leg length, differences in your muscle strength, differences in your orientation can kind of allow the pedals to do this a little bit. Too little float can force you to push against that spring or against that block and can cause more outside knee pain. So increasing the float just a little bit can help decrease the knee pain on the outside of the knee if the cleat is in the right position. And that typically in most manufacturers, they have a zero float pedal, several degree float pedal, and then maybe a double degree float pedal. So changing to a little bit higher float, a little bit more freedom of motion can oftentimes help reduce or eliminate that knee pain problem. On the inside of the knee, if it's not a structural problem inside the knee, one of the things we think about is the cleat is too far toward the inside, toward the big toe side, and shifting that a little bit more to the center of the foot can be helpful with that. My biggest problem is hand problems, okay? As I've gotten older, I've developed a big problem with progressive numbness and tingling in my hands. And that's usually due to a combination of changes that are going on. The first is people can develop thinning of the fat pad in the palm of the hand, which decreases the amount of padding there is. Number two, as we get older, we start to get stiffer, and so we can't flex as far forward as we used to. And so we kind of fall onto our handlebars and put a lot of pressure on our handlebars. Pressure on the ulnar nerve on the outside part of the hand here, the little finger side, can cause numbness and tingling in these fingers. Pressure on the carpal tunnel or the median nerve can cause numbness and tingling in these fingers. And the challenge is it's not only uncomfortable, but particularly if you get these fingers involved, it can actually make it very difficult to control your gears and your brakes. And so the key to trying to mitigate hand discomfort like that is kind of a multifactorial approach. The first is looking at your position on the bike. Are you way, way forward? Are you really leaning on your handlebars? That might mean the stem, which is what attaches the bike wheel to the handlebars, is too long or too low. This is what a stem looks like. And this is a racing stem, and you can see that if the pipe where the wheels are, which is called the steerer tube, is here, and the handlebars are out here, the way this is angled is going down like this. You're actually leaning into the handlebars. Now this is more racy, it's more aero, it can be more efficient in certain types of cycling, particularly flat road speed. But as we get older, as our flexibility decreases, we're kind of forcing our body into a position that it can't really tolerate, and therefore we put more pressure on our hands. The advantage of this stem is one thing, it can be turned up like this, and so now the stem is a little bit more upright, the handlebars are a little bit more upright, And that can sometimes alleviate some of the problems with not being flexible enough in your upper back, in your lower back, or having too little core strength. Additionally, we can buy stems of different lengths. This one happens to be 100 millimeters from the steerer post to the handlebars. Shortening the stem slightly by a centimeter, right, 10 millimeters or more, can oftentimes help to reduce some of that irritability in the hands. There is a little bit of a sacrifice in that. If we start getting too short, the bike gets a little bit twitchy. It gets a little bit too active in its control, and sometimes that can be unnerving for cyclists, particularly going downhill or on rough roads. There's also an option to get a stem that actually has a joint right here in the middle where you can elevate or decrease the amount of angle in the stem. Some hardcore cyclists kind of poo-poo that concept, but it can be a useful tool in trying to fine-tune somebody's bike fit, particularly a little bit older cyclists who may not be quite as flexible, or somebody who's not quite in shape where they have not quite the right amount of flexibility or core strength, and they kind of lean on their hands a lot. So those are some bike fit options there that can help mitigate the hand numbness and tingling. The second thing is, or another thing is padding of the hands. You can get cycling gloves with inserts in this area that adds a little additional padding. I like the ones that have the gel padding in them because they're shock absorbing, but that can be sometimes a useful tool. Or increasing the thickness of the handlebar tape to add a little additional padding can be helpful too. A little caution there though, more padding doesn't necessarily mean more protection. And in fact, if we have too rigid of a padding or too thick of a padding, it can actually force the pressure even more on the nerve. So it's really you got to try it and see what works for you. So hand discomfort is often because we're too crowded into the bike, we're leaning too hard into the handlebars, we're leaning too far into the handlebars, we're not riding with a flexion of the back kind of in about a 45-degree position. We have poor core strength, or we're too tight, particularly in the hamstrings. I'm going to show you this diagram. This is a kind of a cartoon of an ideal bike fit. And what you can see here is with the fellow leaning on the front of the handlebars, the hoods of the handlebars, his elbows are slightly bent, his back and legs make about a 45-degree angle. One thing I wanted to point out here with regard to positioning of the seat back and forth and up and down is when he's sitting on the seat and his pedal is straight forward, so at 3 o'clock, 9 o'clock here, a plumb bob, a straight line drawn from the kneecap down to the ground should kind of fall right where the spindle of the pedal is. So where the pedal attaches to the crank arm, it should be right there in the middle of that. If it's too far forward, that means that the knee is has too much bend in it, where you can get anterior knee pain. If it's too far back, you can get posterior knee pain because the things are too long. And so you kind of want to be able to position yourself that way. Basically, the bike fit for most people should look comfortable and should feel comfortable. And we take into consideration our different body types and make adjustments that way to try to minimize pain. The last topics are in neck pain, back pain. And basically, as I've kind of elaborated before, it's really all about bike fit, flexibility, and core strength. So neck pain can come about if we're too far forward and we're craning our neck back like this and holding it still. That can be very uncomfortable to the muscles of the neck and also the joints of the neck, particularly as you get older like me and have some arthritis in the neck. So bringing yourself upright a little bit shorter stem, a little bit more upright riding position can help reduce that. A second thing that can help reduce that is really remembering while you're riding to work on flexibility. So range of motion while you're riding. So don't just hold one position. You move your head around, move your neck around, give those muscles and ligaments a little bit of a break so they don't kind of get stuck in that one position. Lower back is often due to, again, bike seat position, handlebar stem length, and core strength and flexibility. If we have poor core strength, we can't hold ourselves in that ideal kind of 45-degree position right there for very long before the muscles start to fatigue. And then we either dip our back or arch our back and get into a mechanical problem there. Tight hamstrings can also lead us to not having good flexibility, which then in turn we can't hold that position long no matter how strong our core is. And so it really is a balance of strength and flexibility. We always have to take into consideration our other body parts. So if you've got a bad shoulder, or in my situation, I've got a bad elbow, I can't straighten my elbow all the way out, and so I have to position myself in a way that my elbow's comfortable, that I am getting shock absorption, but that I can also kind of minimize the stress on my back and neck in doing so. So I've had to adjust my cycling position over the last few years because of the changes in my body. This is not a science. It's really an art based on science, okay? So not every one of these pieces of advice works for everybody. The best thing that you can do, if you can afford it, is get a professional bike fit if you're really having trouble with your cycling and pain. This is most important in the road bicycle, this type of bicycle, less important or less easy to manage in a more upright cruiser type bike. People rarely are riding distance in the cruiser type bike configuration, so really these types of things bother people the longer they go, the farther they go, the harder they go. Number one, a professional bike fit can go a long way in making your cycling experience much more enjoyable. If you can't afford it, and it's pricey, there are a number of resources online that you can look up to kind of give you, if you're at all inclined to a DIY, do-it-yourself kind of adventure, that you can do to adjust your own bicycle if you have the right set of tools. And it doesn't take much. It's usually a 4mm, 5mm, 6mm Allen key wrench. Occasionally it'll be a flathead screwdriver, but that's about it. It doesn't take a whole lot, but there's a lot out there. What you look at is appropriate bike fit, or good bike fit, or how to fit my bike. And those types of search terms will allow you to find a number of resources that can give you some information to try to help decrease your discomfort and enjoy your riding. So I think that's about it for today. I hope this has been a little bit interesting to you. You know, we've talked about cycling. We've talked about the importance of proper bike fit and to help minimize pain associated with cycling. We've talked about what interfaces with the bike. The one thing we didn't talk about was your rear end on the seat. But what interfaces with your bike, your hands, your feet, your seat, and those joints attached to your core that are important in trying to minimize pain. We've talked a little bit about knee pain, both front and back, anterior and posterior. We've talked about lower back pain and neck discomfort, and we've talked about some hand issues as well. So I hope these tips are somewhat helpful. My big advice is, more than anything, go out and go ride. There's nothing, for me, more mentally stimulating and enjoyable than getting out and seeing the countryside and riding up and down the hills of Middle Tennessee, which is absolutely gorgeous, to get exercise, a little bit of mental health time, and to see some of the world. So I encourage you that if you are having trouble with discomfort coming from your bike, there's lots of options to try to help improve your situation. Bike fit, core strength and flexibility, modification of your attachment points to the bike. There are some technologies such as cycling shorts, better seats, different handlebar tape, these kind of accoutrements to your bike that can make your life much more enjoyable and comfortable on the bike. So with that, I think we'll wrap up. Next week, I am out of town, so there will be no Facebook Live episode next week. But on July 10th, I'll be back with Dr. David Todd. He's one of our partners who is an interventional pain management specialist. He's still brewing up a topic, but it'll have to do with pain management. We met a few weeks ago with Dr. Bowen. Thank you, ma'am. Dr. Bowen is an anesthesiologist. Dr. Todd is an anesthesiologist. And so he has a lot of perspective on different interventional pain management techniques, so I look forward to talking to him. He and I work together a lot on the spine. With regard to everything else that's crazy in the world, this is a tough time. Be smart. COVID-19 is still not characterized well. We don't know how bad or how not bad this whole thing's going to end up. It's wise to be cautious, particularly if you have risk factors such as being older, sicker, or have pulmonary issues. Wearing a mask is not mandatory in Middle Tennessee yet. Wearing a mask is prudent. Wearing a mask is respectful. And so I encourage you to do that. We continue to wear masks, check temperatures, do screening questions, sanitize between patients in our TOA offices. That, again, is to try to protect you from getting sick. We do ask that if you've been exposed to somebody who tests positive, please don't come to the office until we know you're not positive. If you're showing symptoms, dry cough, headache, fever, these types of things, please don't come to the office unless you have an emergency. There's no reason for you to get sick or give it to somebody else. So we have to be respectful of everyone. Speaking of respect, why can't we just respect one another? How about that? I would like to have one last personal shout out. This is to Mama Jane Miller. Thank you for bringing me into your life. You've given me and Mary so much. I'm so sorry to see you go, but you lived an awesome life, and we love you. With that, go out there and live your best life.